morning, guys. Most of the youngsters kind of suffering from hair fall and hair loss. That is the most of the commonest problem almost every youngster would face. For these since few decades, lot many treatments are come up, but are not that greatly useful. But few treatments like PRP, GFC, and hair transplant really help to people to a certain extent. But about PRP and GFC, lot many doubts also there among these kind of treatments. We would like to make a video on basic information of PRP, that is platelet-rich plasma, and GFC, that is a growth factor complex. What are these two? What are the difference between these two? Who can get this treatment done? All this kind of information I want to make this video. Kindly watch until end to understand the basic information on PRP and GFC. What is a PRP treatment? A PRP stands for platelet-rich plasma. It's an injectable treatment that we are going to give for the hair fall and hair loss treatment. What is a GFC treatment? A GFC treatment stands for growth factor complex treatment. It's again injectable form of treatment we're going to use for hair loss and hair thinning. What is the basic difference between PRP and GFC? Is most of the guys will ask this question. Basically in PRP, what we do is we're going to extract the concentrated platelets, certain amount of concentration platelets we extract, and that we're going to inject in the skin. When it gets to the skin, basically the platelets will break and get activated or break down, gives you growth factor complex inside. So growth factors will be released inside the skin. So that's what we do in a PRP. When it comes to the GFC, outside the body itself, we are going to extract the growth factor complex and then directly inject to the skin. And that's the basic difference between PRP and GFC. What is bio-PRP treatment? Whereas many companies will provide you this PRP tubes, a few companies will provide you with the micronutrients. What do we offer here is called bio-PRP, has 52 types of micronutrients. These micronutrients along with your PRP makes definitely better than plain PRP, because our skin and hair always require many micronutrients and minerals and vitamins to enhance the good cell multiplication and growth. So we do offer here bio-PRP and as well as GFC procedure. What are the indications of using this bio-PRP and GFC treatment, and what are the uses of giving these treatments? Well, one of the best treatment, hair transplant is definitely best treatment, provided your case is you are a good candidate for transplant. That's an invasive surgery, invasive procedure. Whereas conservative management or conventional types of management, like less invasive procedures to address the hair fall issue, these PRPs and GFCs definitely are useful. Basically, in layman terminology, someone who has a family history of baldness, who's losing more hair, they can consider these bio-PRP and GFC procedures to reduce the hair fall, number one. Number two, someone is already having partial baldness and they are losing other hair. For them also these treatments are very useful. Next, people who has, females especially, they are losing hair in the frontal area, mid-scalp, because females has a lot of issues like thyroid problems, multivitamin deficiency problems, and hormonal issues, age issues. All this can be addressed by giving this PRP and GFC procedure to enhance their quality and quantity of the hair. Now, these are the few indications. And someone who's going to undergoing transplantation, for them also we give the PRP and GFC because to enhance the best growth. So next is someone has a poor donor. For them, we cannot do transplant. For them, we can offer the bio-PRP treatment initially for a couple of months. It can enhance the donor growth in the backside, and then again we can take them for the procedure. And any stress-induced hair loss. Stress means traveling, kind of vigorous gym, many types of stress are there. Any kind of stress that induced your hair fall definitely can be addressed with giving this bio-PRP treatments, which will enhance the quality of the hair and hair health. Few patients who undergoes radiotherapy or chemotherapy for different reasons, they also lose a lot many hair. For them, immediately after their treatment, if you can give the bio-PRP and the medications, definitely they can regain their hair back. That's the another indication for the bio-PRP and GFC. Few patients has a diffuse pattern hair loss. That means they have a little thin hair everywhere. For them to definitely maintain for longer duration, they can go for the bio-PRP treatments. And someone who has a good hair really want to maintain for longer duration, they also can consider taking the bio-PRP treatments. These are the treatments are definitely worth taking if you are having this hair loss issue, even hair thinning. Some people have very thinning, shaft become thinner and thinner, and these are the few indications where they can consider the bio-PRP and GFC procedures. What are the precautions or prerequisites that you should take before bio-PRP procedure? So basically, it should be healthy. Imagine someone is suffering from some viral fever or any kind of fever, better not to take the PRP. Someone has issues with anything, systemic diseases like any diseases, so which can cause problems with your health, probably you cannot go with bio-PRP. These things you need to bring to your doctor before taking the procedure. And a general note, someone had alcohol less than 6 hours, they cannot go with PRP. So these are the things we can consider avoiding before PRP. And there are a few patients has a low platelet count because of recent viral fevers. Also should bring to a doctor's notice whether to go with PRP or not, because certain amount of low platelets we don't yield a good PRP, so we need to wait for a couple of weeks and then go for the bio-PRP. So other than that, prerequisites like you should have breakfast and come to the clinic to take your bio-PRP procedure, and do not have alcohol for 6 hours before the procedure, and you need to wash your hair and come for the procedure. These are the basic things. What are the post care after GFC or bio-PRP? What are the care one should take? That's the most of the guys will ask me. Basically, after PRP or GFC procedure, you can get back to your work immediately. There's no worry about any going to gym or sports activities, driving your bike or driving your car, and you can use helmet. No worry at all. So there is no post precautions much. You can alone come and get it done and get back to the work immediately. So you can get back to your office immediately. You don't have any issues with PRP after the session. Basically, how much time will it take to get it done one PRP session? So for bio-PRP session, hardly takes 15 to 20 minutes. So we are going to extract 8 ml of venous blood and put in centrifugation and inject it under local anesthesia and send you home. When it comes to GFC procedure, it will take almost 40 minutes. Because once we take 16 ml of the blood, we need to keep it 30 minutes, then we send it for centrifugation. So it will take at least 40 minutes for the GFC procedure. Next important question is, will it pain? And how does this procedure done under anesthesia or not? That's what most of the people has doubts. I'm sure it doesn't pain much, because someone can able to give the blood, that much pain if they can tolerate, and PRP is possible. And 1 or 2 few pricks can be given in the frontal area to make it numb. That's a local anesthesia. So otherwise, it's a very much tolerable procedure. So both GFC and bio-PRP goes same under local anesthesia. So most of the guys are asking me, would you give local anesthesia? Yes, local anesthesia would be given, because without that also few guys will give it, but I don't recommend. We don't recommend that way, because we can able to give complete area if there is no pain. If the patient suffers pain, we cannot give the PRP properly. That's the reason if you can tolerate few pricks, 2-3 pricks in the front, it will become numb. Later you will not have any pain, so that doctor also can able to inject uniformly everywhere. That's what. And this local anesthesia would not damage your health or damage your hair while doing the PRP, because this is commonly used in any dental procedure, any procedure in the worldwide. The safest medicine is the lidocaine, that is the local anesthesia. So it doesn't damage any of your hairs as well as your health also. No need to hesitate to get it done under local anesthesia. Usually, how many sessions would it require, or what is the frequency of the PRP or GFC? Most of the guys will ask me. Usually 6 sessions is a must because hair, whichever this falling stage, it will take 4 to 5 months to grow, and that's the minimum time it will take to grow. It will grow to adult in a different level because in women it will take more than 8 to 9 months to grow longer. So minimum recommended 6 sessions, even more, to get you optimum results of PRP or GFC. Kindly do not expect any results in 1 or 2 months, 3 months, because it doesn't even respond that much quickly, because hair is very slow to grow. It will take a lot of time. So that is the minimum sessions. So 6 would be required or even more, both either bio-PRP or even GFC also. Even it is the same with multivitamin therapy also. So that means frequencies, monthly one is recommended. There is no particular date and time like that, but it's better 25 days to 35 days. So better monthly one. There is no need to take more than that. It's not necessary to take 15 days once, because monthly ones would be enough to get you the optimum results for you. So monthly ones, 6 months minimum recommended. And if you ask me, can I take more? Yes, definitely you can take more. It doesn't harm you. What would happen and what happens after first session of PRP, during first month or during second month? Because most of the weak hair tend to fall. You may see little more hair fall. One should not be panicked. That is most commonest thing will happen to you. Most of the guys will face it. That means it's going to knock out all weak hair and get in new hair. What are the hair about to fall also will fall off, but nothing to worry. These are all temporary. It happens because of multivitamin therapy or because of minoxidil or because of PRP, whatever it is. That will regrow within 2-3 months. One should not be panicked at all. So first PRP can get you some kind of more hair fall for you. So when you see that hair fall, kindly make a note. It's normal, nothing to worry. What is cyclical multivitamin therapy? Is it necessary along with PRP? This is another question most of the guys will ask me, because I'm taking bio-PRP or GFC treatment. Should I also take multivitamins? That's what the people will ask me. These medicines will come in 2 types. One is the multivitamin therapy. Next is the minoxidil and finasteride. So these are a set of medicines you would get to use it. Let me tell you how this bio-PRP works, because PRP has we got a concentrated platelets. In that we have a growth factor complex. Growth factors will be released, and then it will enhance the growth of the each cell, multiplication of each cell. While it is happening, our body also has to have kind of rich in nutrients. Imagine you are suffering from vitamin D, vitamin C, vitamin B12, even iron, all this. If you have deficiencies, most of the nowadays, most of the working guys, working women or men, whoever it is, because we don't expose to sunlight, we don't have a proper vitamin D and vitamin C levels also. So in them, even if you give bio-PRP, even there is a growth factor complex given to your scalp, because there is no multivitamins and minerals, vitamins in your blood, cell multiplication will not happen. For any cell to multiply, you need to support a lot of manures. That means multivitamins, minerals, and all this. Otherwise, your PRP may go waste. Most of the Indians, we suffer from a lot of multivitamin deficiency because we don't get any symptoms. And unless you check the blood check, usually we don't get symptoms. That's the drawback of the multivitamin things. That's the reason multivitamins will work in a different way. A PRP works in a different way. So when you give multivitamins, the quality of the PRP will be so good. Quality means, imagine we are going to inject concentrated platelets along with plasma. This plasma is a vehicle for transporting all these micronutrients in our body. This plasma also has to have a rich in nutrients to get a good benefit for your hair. That means not only concentrated platelets and growth factor complex, also we are injecting plasma. Kindly remember that this plasma, if it is rich in nutrients, it's going to help you a lot better in a hair growth. That's the reason multivitamins makes definitely different good sense along with the bio-PRP to see optimum good results. What is the procedure for this bio-PRP or GFC? Well, the procedure goes very simple. We already discussed about bio-PRP takes only 15-20 minutes, and comes to GFC it will take 40 minutes. Usually we take 8 to 9 ml of blood for the bio-PRP. Well, there are a few different tubes. These guys will take 20 ml, 30 ml, 40 ml. These are the old methods. Now latest methods are come up, because here we need optimum concentration. That means when we are taking the concentration of the platelet, it's supposed to be between 8 to 10 lakhs concentration. Otherwise, if it is less or more, it doesn't work. That's the recently proved. That means it's not the quantity. So it depending on the company, each tube will accommodate 8 ml. Some guys will give you 16 ml tubes. So depending on the company, don't break your head with that perspective, because whatever the company is giving you, it will approximately give you the accommodation of the blood inside. So it's a default, it will take only 8 to 9 ml. Whereas it comes to GFC, it will take almost 16 ml. That's the difference. When we take the venous blood and then we'll keep it in a centrifugation machine, we'll collect the venous blood in the specified tubes for the bio-PRP or GFC different. These tubes we are going to put in a centrifugation machine. Centrifugation done for a couple of minutes, 8 to 10 minutes depending on the specifications. We will get this PRP into hand. A lower like plate, these RBCs, WBCs settle down below. That part we are going to discard. Upper layers, that's the rich in plasma, that we are going to rich in platelets, that we are going to take it in a small tiny syringes and we are going to inject it in the scalp. Whole procedure goes under local anesthesia, can be finished in 15-20 minutes for the bio-PRP, whereas it will take 40 minutes for the GFC. For GFC, why it is 40 minutes is, once we take the blood and before putting in a centrifugation machine, we need to keep it 30 minutes outside. That's the reason it takes 40 minutes. So this is the procedure. It goes very simple as a daycare. After the procedure, you don't feel anything much swelling, any pain. And immediately you can do hair wash, no worries. Or next day you can do hair wash, no problem. So you can get back to your work, gym, you can use helmet, you can drive, you can ride the bike. So that's not a big procedure. It's kind of a daycare, a OPD kind of a procedure. Are there any side effects or harmful effects, adverse effects of this PRP and GFC procedure? Yes, well, we have to consider candidates or patients for PRP provided if they are fit enough. Imagine someone has recently had a viral fever, having very less platelet count, we cannot take them. Someone has a syndromes like platelet syndrome, we cannot do. Someone has a systemic diseases like liver diseases, kidney diseases. These things we need to reevaluate and kind of we need to take consent from the corresponding doctors and then go for PRP. These are the few things we have to avoid bio-PRP or GFC procedures. Well, once you take the PRP or a GFC, when you are fit enough, I think usually side effects are very minimal and there are no side effects I can say, because it's your own blood. It's your own blood, we are going to take it, and centrifugation we are doing and we are injecting it. That's the safest procedure I can say. That's the reason one should not worry about any side effects of the PRP, because we keep on doing, been doing almost last couple of years, more than 12 years, we have been practicing the bio-PRP and other procedures. So I think it's very safe procedure to undergo if you are medically fit enough to take the procedure. Well, these kind of conservative managements like less invasive procedures, definitely worth taking it when you are really worried about your hair fall issue, rather once you lose all hair and taking care of it. Usually most of the guys will say, I want to try bio-PRP right now, because by then you will be class 5, class 6 baldness. It would not help you. It's a very beginning phase. If you can address this problem, definitely you can maintain your hair for longer duration than if you ignore the treatment. So when there is a comparison, if you can take bio-PRP and other treatments, I'm sure you can maintain the longevity of the hair. That means you can maintain for longer years. If you ignore the treatment, probably you would lose hair little early age and which cannot be recovered. So rather addressing this problem once you go completely bald, is better to address it before initial phase. If you take care of initial phases, definitely it has a more value and is worth taking when someone doesn't want to go with the transplant right now for their existing hair maintenance. Definitely they can go with the bio-PRP and the GFC procedures along with the multivitamin therapy. Thank you. Thanks for watching.